Hello everyone. I am going to make part 2 of a video regarding frequently asked questions when you go see a therapist. Question number 1, how much does it cost? So this question, it kind of depends on where you live. I practice in Alberta, specifically in the city of Edmonton, and you will probably see a range of 200 to 225. And the reason for that is because we have guidelines in how much we can charge. And then it depends on who you're seeing. So if you're seeing a counselor, so a CCC, Certified Canadian Counselor, you might see a range in there as well. And it could be around $200. And like I said, it depends on what province or what state. And then there are benefits. So many benefits, especially in Alberta, will cover a provisional registered psychologist or registered provisional psychologist, which I am, and also cover registered psychologists. Sometimes through your health spending accounts, you can use that to cover whether you see a counselor, therapist, psychotherapist. So I hope that helps a little bit, but typically it is around 200, and if you do have benefits, it usually caps out at a certain amount. So just check with your benefits prior to seeing somebody, and then you can kind of average out how many sessions you can go to annually or per your benefit schedule. The next question, and I get this question a lot. What is the difference between a provisional psychologist, a registered psychologist, and a psychiatrist? So provisional psychologist, which I am, is that I am in the pre-phase, I guess, before becoming a registered psychologist in Alberta. So when you're in this phase, you are required to do 1,600 hours under supervision of a supervisor. And so you would meet with this supervisor every 15 hours of clinic face-to-face hours, and then you would meet with this person, so once every 15-ish clients, and you have to write a licensing exam. So there are some requirements. For someone like me, I had been a counselor prior to becoming a registered provisional psychologist. I was a CCC and I was working in the school, so I have experience just under a different title. Now, when you're a registered psychologist, and both registered and provisional psychologists fall under CAP in Alberta, so the College of Alberta Psychologists. And when you're a registered psychologist, you have passed the licensing exam. You no longer have that required supervision, but there's some other requirements that you need to maintain. There is an ethics guideline that we follow, and there are some other things that you need to just adhere to. So that's the difference between provisional and registered psychologist. Obviously, there's a little bit more, but I'm doing this in a nutshell. Now, a psychiatrist. A psychiatrist is somebody who is under the mental health umbrella, but they are in a medical lens. So they are the ones that are able to prescribe medications for mental health. So can you get medications from someone other than a psychiatrist? You can get some, like from a doctor, from your GP, or from other health professionals. But typically, if you want to see someone, if you have maybe medicines that you've been taking for a while and they're not working, or you have some curiosities in terms of what medications to try, a psychiatrist might be something to explore. But typically, you need to get a referral, at least in Alberta, to see a psychiatrist. Now, are there some other ways to see a psychiatrist without a referral from a doctor? Yes, you can get a referral from, say, a psychologist, a registered psychologist, but there's always going to be a wait time, and some psychologists don't do that. So a cleaner way is to go through a doctor, and the wait times can be a little bit longer. It just sort of depends on who's accepting clients and that kind of stuff, and if you're a child versus adult. Now, the third question, what is confidentiality? So this is something that comes up a lot because people say, are you not going to tell anybody anything that I share with you? And the answer is yes and no. So as a provisional psychologist, I have a supervisor, and my supervisor, I have two, they support me with my cases. So at the first session with clients, I'll always mention that I have a supervisor. Some of the information you share with me, I may speak to my supervisors about, since they're going to support me working with you. So it's kind of like a 2-in-1 deal. So that would be a stipulation when you're a provisional. And then whether you're provisional, if you are a psychologist, psychiatrist, there are some other reasons why confidentiality would be broken. So the majority of times, the information you share with your therapist is going to be confidential unless these things occur. So number one is if there's any disclosure of suicide. So if you share that you have a plan, you're imminent risk, there will be steps to be taken to ensure your safety. So some of those might be to call your contact individual that you listed on your informed consent. It may be to call 911 if there isn't anybody to bring you to the hospital, because your safety is so important. The next one is if there's any disclosure of risk of harm to anybody else. So if you share that you are going to go and hurt somebody or cause damage to somebody, we have a legal obligation to tell this person and try to ensure their safety. Now, if there's any mention of abuse or neglect regarding an elder or a child, there's also steps that need to be taken to ensure their safety because they're a vulnerable population. And once again, it comes back to safety. The next one is if there's a court order or subpoena. So in this case, if my chart notes, so those are the notes I take during session, get court ordered or subpoena, I would have a legal obligation to comply with that. So those would be the main reasons why confidentiality would be broken. If there's any safety risk, suicide risk, and this has to be imminent risk, and then of course abuse, or if there's a legal component and there's a request. So those are the questions for today. I hope that kind of helps a little bit in terms of what this counseling, psychology, therapy world is all about. And I hope you found it interesting. Take care, and I will hopefully see you soon.